Well, you're very welcome to today's talk. It's Friday, the 4th of June. I've got some news from the UK and the US, some important developments on vaccination. And we're going to look at long COVID a little bit as well. Not so much the clinical features of it, but the prevalence of it in the UK. There's been quite a lot, and it's been reported by the Office for National Statistics. So we've got some sort of firmer data on that, really for the first time. Now, let's start off with the United States, though. So here we have the cases in the United States, which we see are going down still progressively, still going down nicely. Now, why are cases going down so well in the United States, despite life, we believe, in the States essentially returning to normal? Well, obviously, it's immunity. And the summer weather. So people are outside in the summer weather, they're making more vitamin D. I think that's probably a bit of a factor. But the main factors here are the vaccination programme. That's by far and away the main programme, the main reason that programme is going well. And also, I don't know if we'll ever find this out in detail, but I think there's been a lot more natural infection, maybe over 100 million cases in the United States, people that have been naturally infected, therefore develop some immunity. And when they've been vaccinated as well, they get a really good quality of immunity, having had the natural infection and the vaccination. So I think it's those factors. And it looks like this trend is going to continue in the States. Now, you can never say, of course, but it's looking pretty good for the States. Now, unfortunately, in the States, if we go up to the metric here for deaths, they're still going down, but really quite slowly, as we see here. So a much more gradual reduction in the death levels in the States. So click on the graphics, click on the links, look at the graphics for yourself. So last 24 hours, it was 14,354 new cases in the States. These are the officially diagnosed, tested cases. But if we add to that perhaps another 60 million or more for the people that have been naturally infected and the vaccination, you can see you're getting up to quite large percentages of the population. Now, deaths in the States, the news media today, in fact yesterday, as of Thursday, were reporting that the deaths in the States have reached 600,000 deaths in the States. And that does seem to be accurate. The CDC data here is always a bit out of date. So just one of these milestones, just time to pause and remember that 1,600,000 people have died as a result of COVID over the last 18 months or so in the United States. And many people around the world, of course, in places where deaths aren't as well recorded as in the United States. So quite sobering, really, when you think about it. Vaccinations, at least one dose, 51% of the population, 169 million. Fully vaccinated, 41.2% of the population, which of course is good. It's very, very good. But my concern about the United States, I'm going to show you on the next graphic here, which is this one, which is trends in vaccination. And now, the whole area under the graph, of course, is the total number of people vaccinated. But the daily numbers are still going down. The number of vaccines given out in a 24-hour period, there are, just over the million mark, 1.286 million. So the 7-day rolling average, 1,278,276. And this is not caused, as we well know now for the States, of course, it's not caused by shortage of vaccines, it's caused by shortage of arms. Now, if you're arms to put the vaccines in, now if you're in the States, I'm pretty confident if you're watching this video, you will have been vaccinated. It's just a matter of encouraging our brothers and sisters, friends and neighbours to do the same. Because the number of cases in the States is not yet irreversible, because there's still this possible effects of the of new variants, and there's still cases there. It hasn't fully gone away yet. So that's a duty for everyone to perform, I believe. So in terms of the vaccines used in the States, so we see Pfizer's pulled ahead, 70 million doses, Moderna 55 million doses, Johnson & Johnson just under 11 million doses. And of course, they're fully vaccinated with 1 dose. And that particular metric is those that are fully vaccinated. And that's the vaccine trends. Click on that and check it out for yourself. It's always good to have the latest bang up to date information. Now, global vaccination program in the States. President Biden is committed publicly to exporting 80 million doses of vaccine this month by the end of June. Now, this will make the United States the biggest global distributor of vaccine and by far the biggest contributor to the COVAX program. So again, with the States, it was like their own vaccination program. It started off slowly, but once it gets going in the States, it really gets going. Their production capacity and everything is just immense. So I'm expecting this will probably increase. But 80 million doses by the end of June. And the vaccines involved are going to be Pfizer, Moderna, Johnson & Johnson. And we already know they've given some AstraZeneca to Canada, for example, about 4 million doses. And we believe there's about 60 million doses of AstraZeneca sitting in the United States, and they're not using them themselves. So they will probably be contributed to COVAX as well, I would imagine. Now, the United States are mostly going through the COVAX program. That's being argued about in the States, of course. Anyway, the first 25 million doses have been allocated, 6 million to Central and South America. Excellent. 7 million to Asia. That should be Africa. That one's Africa. 7 million to Asia, 5 million to Africa. 6 million allies in need. Not sure what that means, but so allies of the United States who need vaccines. I suppose that's open to interpretation. And they're mostly controversially going through the COVAX program. So perhaps the United States logistics, once it gets organised, would be better to give the vaccine out via its own offices, or they might continue to go through COVAX. We don't know, but it's mostly COVAX at the moment. So good news from the United States, and that will make the United States the main vaccine contributor. But they are coming to the party late. Let me just give you an example of that. So we looked at the World Health Organization approving Sinovac, the Chinese vaccine, which uses the whole viral particle. We looked at that yesterday. It was just approved a couple of days ago. Now, whereas Oxford AstraZeneca and now Sinovac have contracted production of the vaccine out, the Pfizer, Moderna don't seem to be doing that. There seems to be a reluctance to do that, this intellectual sharing business. But it looks like the Chinese have shared the technology with the Pakistani government. So Sinovac, it is Sinovac, so presumably it's the same Sinovac. It's the same vaccine that can be transmitted at low temperatures with good levels of efficacy as we saw yesterday. Presumably it's the same vaccine that's brewed up, that the virus is brewed up on monkey, chimpanzee, is it? Some sort of monkey kidney cell culture. So presumably that's all the same, but it's being made actually in Pakistan. And of course, this saves the logistics of transportation from China. So this is good to see. And in Pakistan, it's being called PakVac. So PakVac in Pakistan is going to be the same as Sinovac, made under license. And I think it really would be good to see more vaccines being made under license around the world. Distribution of vaccine production technology. Now, this is Dr. June Raine, Chief Executive of the Medicines and Healthcare Regulatory Agency in the UK. And today, Friday the 4th of June, they've just approved the Pfizer vaccine for 12 to 15-year-olds. Now, this is not saying that other vaccines are unsuitable for young people. It's saying they're not approved. But the Pfizer one is where the first data came from, and the trials have been going on with Pfizer to look at the efficacy and safety of the vaccine in 12 to 15-year-olds. And now the MHRA, Medicines and Healthcare Regulatory Authority, MHRA, has approved it. Direct quotes: "We've carefully reviewed the clinical data in children aged 12 to 15 years And when they say carefully, they do mean carefully. They really go through this completely thoroughly, and have concluded that the Pfizer BioNTech COVID vaccine is safe and effective in this age group, and that the benefits of this vaccine outweigh any risk. All direct quotes from the MHRA. So there you go. That's what they are. That's what they're saying. So a pretty unambiguous series of statements there from the Medicines and Healthcare Products Regulatory Agency. Now, moving on to the UK itself, Office for National Statistics have published data just yesterday, I think it was. So this is taking us up to week ending the 21st of May. Prevalence in England, the number of people with the virus, 0.09% of the population in the week up to the 21st of May. So that's the week from the 14th of May to the 21st of May. That's 1 in 1,220 people. That was on that week. Wales, remarkably low, 0.03% of the population. That's 1 in 3,850. Northern Ireland, a bit higher, 0.12%, 1 in 820. And highest, unfortunately, at the moment in Scotland, 0.16% was the prevalence people with the virus in that week in the country. These are all estimated figures, but they're estimated on pretty large-scale surveys by the Office for National Statistics. So they are by far the best figures we've got, by far the most accurate figures we've got. And in Scotland, that equates to 1 in 630 individuals in that week. Direct quote from the Office for National Statistics released 2 days ago. These are likely to be compatible with variant B1617.2, first identified in India. So interesting, the Office for National Statistics in the UK are not yet using the new alpha, beta, gamma, delta nomenclature as dictated, suggested, whatever you want to put it, by the World Health Organization. I think it's useful to name viruses by where they were first came from. As far as I know, the people in Kent aren't very put out by the Kent mutation, and I live in the UK, and I'm certainly not put out by the terminology UK mutation. Okay, we are abbreviating to the mutation first discovered in the UK, but at least people know what you're talking about. I think the World Health Organization moved to call alpha, beta, gamma, delta, epsilon, zeta, or whatever it is it kind of doesn't mean anything. They're just like nouns rather than descriptive terms. But that's the World Health Organization. Who are we to argue with them? Deaths in the UK, 107 over the 7 days certificated. This is in the week up to the 21st of May. These are death certificates not tested and death within 28 days of a positive test. The week before, that's the week from the 7th to the 14th of May, it was 151, so a reduction. And this is actually 3.2% below the 5-year average. So deaths are actually lower than the 5-year average at the moment, which is fine. We'll accept that. Now, let's have a quick look at the screens for the UK here. So vaccination programme 75.5, one dose, 50.2% for the second dose. And the people vaccinated going up nicely. These are percentages of the adult population, of course, but what is concerning here is the increase in cases as of now. This is as of the Friday the 4th of June, and we see cases are up 38% on a 7-day period, which of course is a continuation of the trend we've just looked at from the Office for National Statistics. So people tested positive, up 38.9% in the week. Patients admitted also up slightly. This is bad, of course, but it's not massive because the overall numbers are still highly manageable. Deaths, as we see, carried on going down, which is good. Why are cases up? Well, perhaps the main reason cases are going up is the India variant. The reason I'm saying that's probably the main factor is that the areas with greatest increase are those where the India variant first became most prevalent. Now it accounts for, I think the latest figure was 80% or more than 80% now of the total number of cases in the UK. In other words, the India variant has now become the dominant variant in the UK by quite a large margin, replacing the old UK Kent variant, the B11. 7. So if we look at cases in the UK, though, put this in some sort of context. I was going to say this, the second reason is the fact that we're going in each other's homes now, of course. So indoor mixing is probably as big a factor now as well. Or I still think the India variant's the biggest factor, but we did expect an increase in cases when social mixing was increased. Now, whether this is going to be the final release on the 21st of June or not, we don't know yet. That announcement's going to be on the 14th of June, so we've got to wait 10 days for that. But Portugal did go on to the amber list today, which a lot of people are upset about, but there you go. But if we look at the overall number of cases in the UK, this puts it in some sort of context. So we see they're going up, but thankfully still relatively low compared to where they have been. Likewise with healthcare provision, so people admitted to hospital, their numbers there still relatively low. The people in hospital, again, the numbers still relatively low. These are the number of people in hospital with COVID, of course, and certainly compared to the peaks, fairly low. Let's look at the up-to-date daily figures for deaths. So about the same over the past few weeks, 115 over the past week. So pretty similar. It was 107, of course, on the week ending the 21st of May. It was 151 on the week ending the 7th of May, and that's where we're at now. But we see the numbers are much less than they have been. And as cases increase, deaths will not increase with cases this time because the vaccines have broken the link between the increase in cases and deaths. Now, the last thing to do today on this segment, well, we'll see how we go, but long COVID. Officially reported now by the Office for National Statistics. Now, this is in people self-reporting with long COVID. So at the moment, it's relying mostly on self-reporting. More than 1/3 symptomatic after a year. So of the people who have self-reported with long COVID, of that group of people, more than 1/3 are reporting symptoms after a whole year after they first got the infection. So this is clearly a burden of morbidity for certain groups of people. And of course, this data has been accurately collected now in the UK. And the modality of the data collection is being improved all the time. And there's no reason to assume that this level of ongoing morbidity due to the long COVID is not proportionately the same in all countries that have suffered the cases in the pandemic. This is going to be something which emerges and is going to be a problem, unfortunately. I believe, unfortunately, well, we know it's a problem still a year later. We don't know how long it's going to last. I would be speculating. A proportion of cases will last for a long time. Whether the majority of cases last for a long time, I don't know. The reason I'm saying a proportion of cases will last for a long time, these will be the cases with physical tissue damage, so lung damage, heart damage, kidney damage. That's not going to fully recover. Whereas other people suffering for immunological reasons may recover and may respond to things like anti-inflammatories. But what we can say in the natural circumstances is an ongoing problem. So as of up to the 2nd of May 2021, 376,000 people infected in the first wave. So that's like back January, the first wave. So that's in 2020, isn't it? So March, April, May, June time 2020. Still symptomatic after 1 year. So 376,000 people in the UK still symptomatic after 1 year, and proportionately it will be the same in other countries as well, unfortunately. This is transpiring to be, I must say, a bit of a bigger problem than I had feared it would be. Out of 1 million people with self-reported long COVID, more than 4 weeks. So initially, in other words, 1 million people reported they had long COVID a year ago. And out of that million, 376,000 are still symptomatic 1 year later, which is what we said about the more than 1/3. So people still suffering. Now, of those reported long COVID, 63.7% said there was some limitation to day-to-day activities. 18.8% day-to-day activities limited a lot. So we can see that this is adversely affecting really quite quite large numbers of people, unfortunately. Now, you would suspect it's the older people that are suffering more because they suffered more from the original COVID severity, if I can find the right screen. But it's the 35 to 69-year-olds that are more likely to report long COVID than the over 70s. So this appears to be particularly a problem in the 35 to 69-year-olds who've had COVID-19. The slightly younger age group. Again, a bit of a surprise, but we're talking about potentially years of working life here and family life. It's a real issue. Be interesting to see if the data is consistent when it starts to come out of the United States, but I see no reason why it wouldn't be proportionately consistent in Europe, the US, and basically anywhere in the world. Now, the methods for studying long COVID are still being developed by the Office for National Statistics. So they're saying relatively more common in, they're not putting figures on this yet, but relatively more common in females, deprived parts of the country, health and social care workers, unfortunately, and other activity limiting health conditions. So, for example, people who've already got chronic obstructive pulmonary disease or chronic congestive cardiac failure. Relatively more common in those groups, but definitely these figures are quantified now. The limitations and the age group have been the main age group have been identified, although the percentages of differences between that age group and the over 70s age group have not. So more accurate data, it looks like the ONS are going to be reporting on that on a weekly basis from now on. So a clearer picture should emerge pretty soon. And I think we've looked at the graphs. Did we look at the graphs from the UK? I think we looked at them all. Yeah, we looked at those, didn't we? Just look at the vaccination one. I don't think we looked at that. Yeah, so this is a first dose of the vaccine, and we see it's a high level for people getting the second dose of the vaccine now, which is consistent with the government strategy, which now advises an 8-week gap between the two vaccines as being what is sort of the default, should be the default position now in the UK. And that is the link for all of those. The concern is the cases are up 38.9%. The question is, which way are the government going to jump? So that's being announced on the 14th of June. Are they going to delay the 21st of June for complete liberation from essentially all restrictions, or are they going to delay that for a period of time? And suffice it to say that is a topic of active debate in the UK at the moment. Today's papers and news articles are highlighting that debate. And the politicians are desperate to have complete reopening on the 21st, but which way they're going to jump, I really don't know at the moment. Yeah, I'll give you a definite maybe on that. I really don't know. Interesting to see. Well, that is us for today's update. Have a great weekend for tomorrow and Sunday.